Welcome to the Rare Wellness Podcast, where we explore cutting-edge ideas in regenerative, longevity, and performance medicine, all delivered in bite-sized segments. I'm Dr. Jamie Lewis, and today I'm flying solo for a focused conversation about cold laser therapy for painful conditions. We're going to focus on the 4 wavelengths that make cold laser work, what each one does, how deep each one reaches, and what the published evidence supports them for. This podcast is brought to you by the Center for Regenerative and Performance Medicine, located in the beautiful Pacific Northwest. Visit us online at www.c4rpm.com. Quick disclaimer, this podcast is for educational purposes only and is not medical advice. Always consult a qualified healthcare professional for any concerns or before starting a new treatment. Here's the frame for the next 10 minutes. Cold laser is not one thing. It is a family of specific wavelengths of red and near-infrared light, each with its own tissue depth and its own job. If you understand the wavelengths, you understand the therapy. The bumper sticker. Match the wavelength to the target, and the evidence follows. Musculoskeletal pain first, then neuropathic pain. Quick science. Cold laser, also called photobiomodulation, PBM, is the use of red and near-infrared light to drive a chemical reaction inside your cells. The light gets absorbed by an enzyme in your mitochondria called cytochrome C oxidase. That enzyme normally has nitric oxide hanging off of it, which inhibits its function. The right wavelength of light dislodges that nitric oxide. 2 things happen. Your mitochondria start making more ATP, and that released nitric oxide locally dilates blood vessels. More energy, better perfusion, less inflammation. That's the mechanism. The reason wavelength is everything is twofold. First, cytochrome C oxidase has specific absorption peaks. It doesn't respond equally to every color. The peaks fall in the visible red around 660 nanometers and in the near infrared between 800 and 850. Second, different wavelengths penetrate to different depths. Visible red stays shallow. Near infrared reaches deep tissue. So when you choose a wavelength, you're answering 2 questions at once. What target am I lighting up, and how deep do I need to go? Let's walk through the 4 wavelengths one at a time. 660 nanometers, the visible red. This is your superficial wavelength. It penetrates somewhere in the range of 5 to 10 millimeters in human tissue. It hits cytochrome C oxidase efficiently, so it's the workhorse for skin healing, scar remodeling, superficial wounds, and the most superficial layer of tissue. Where 660 shines is anything you can see: surface trigger points, superficial musculature, skin level inflammation. Where 660 is limited is depth. If the target is a sore Achilles tendon or a deep gluteal muscle, 660 alone is not reaching it. You need a longer wavelength for that. 800 nanometers and the closely related 808 and 810 you'll see in the literature is the deep tissue photochemical workhorse. It is invisible to the eye, it penetrates roughly 30 to 40 millimeters into tissue, and it sits right on a strong absorption peak for cytochrome C oxidase. If you read a positive musculoskeletal pain trial, tendinopathy, neck pain, low. Back pain, knee osteoarthritis, the odds are very high that 800 to 830 nanometers was the wavelength in the protocol. This is the wavelength most of the modern evidence base is built on. When somebody says cold laser worked for their knee, what worked was almost certainly somewhere in this 800 to 830 nanometer band. 905 nanometers is a little different. It comes from a gallium arsenide laser diode. And the key feature is that it's almost always delivered in what's called superpulsed mode. The diode physics doesn't allow continuous high power output, so it fires extremely short, very high peak power pulses. The clinical advantage is deeper penetration than 808 with relatively low average power, which means you don't heat the tissue. The catch is peak power is not the same as average power. An effective dose has to be calculated on average power. So 905 done right is excellent for deep targets like joints and peripheral nerves. 905 done wrong, where the marketing quotes peak watts to sell you a device, is misleading. When it's dosed properly, 905 is one of the most important wavelengths for deep pain. 970 nanometers is different from the other three, and it's worth understanding why. 970 sits very close to a strong water absorption peak. Water is everywhere in tissue, so a lot of the energy at this wavelength turns into gentle, controlled heat. That isn't classical photobiomodulation, that's photothermal effect. It still has therapeutic value. Heat increases blood flow, relaxes tissue, and at the right dose, it has its own pain-relieving properties. The right way to think about 970 is as a thermal adjunct, blended with 800 and 905 to combine the photochemical effect of the lower wavelengths with the warming effect of 970. It is not a substitute for the photochemical wavelengths. It is an addition. Here's why this matters clinically. A consumer red light panel typically delivers 1 or 2 wavelengths, low irradiance, and penetrates about 5 millimeters. That's fine for skin and very superficial tissue. But if your target is a knee joint capsule, a deep tendon, or a peripheral nerve sitting 2 centimeters below the surface, that panel cannot physically deliver enough photons to that depth in any reasonable session length. A therapeutic device that fires all 4 wavelengths, 660, 800, 905, and 970, lets you tune the treatment to the target. Superficial trigger point, lean on 660 and 800. Deep tendon, 800 and 905. Joint with muscle guarding, stack 800, 905, and 970. That's why multi-wavelength class 4 devices exist, not because more is always better, but because matching the wavelength to the target is the whole game. Now let's get into the evidence by condition, and I'll tell you the wavelengths used. Neck pain first. In 2009, Roberta Chow and colleagues published a systematic review and meta-analysis in The Lancet, 16 randomized controlled trials, 820 patients. The wavelengths in those trials clustered in the 780 to 830 nanometer range, the deep tissue photochemical band. The finding was that laser at those wavelengths reduced pain immediately after treatment in acute neck pain, and the benefit persisted up to 22 weeks after the treatment course in patients with chronic neck pain. The Lancet does not publish that conclusion lightly. For chronic mechanical neck pain, 800 nanometer range laser is one of the better supported non-pharmacologic options we have. Knee osteoarthritis. This is where wavelength and dose specificity come together. The early meta-analyses were mixed, but when later analyses restricted the pool to studies using World Association for Photobiomodulation Therapy, WALT, recommended parameters, the picture changed completely. A 2024 network meta-analysis found that 785 to 860 nanometers at 4 to 8 joules per square centimeter, or 904 nanometers at 1 to 3 joules per square centimeter, produced significant reductions in pain and disability on the WOMAC scale. Notice the specificity, 2 distinct wavelength bands with specific dose ranges for each. Laser combined with exercise therapy outperformed exercise alone at 4 and 8 weeks. The takeaway: for the knee, the photochemical band around 800 to 860 and the deeper penetrating 904 both have evidence when dosed correctly. Low back pain. The biggest systematic review found that photobiomodulation as a standalone for non-specific low back pain produced clinically small effects. But when laser is added to exercise, same pattern as the knee, the combination outperforms exercise alone. Trials in this space have typically used 808 to 905 nanometers because the lumbar paraspinal targets and facet joints sit deep, 5 to 7 centimeters below the skin in some patients. This is a depth problem first. The shorter visible wavelengths simply cannot reach the structures generating the pain. Shoulder pain, rotator cuff tendinopathy, frozen shoulder, biceps tendinopathy. A 2025 systematic review on tendinopathy found that low-power laser delivered in the 800 nanometer range showed limited standalone effect, but high-intensity laser therapy at the same wavelengths with sufficient irradiance to reach the deep tendon insertion produced significant reductions in pain and disability. That's not a different wavelength. That's the same wavelength delivered at higher power, so the photons actually reach the target tissue. The review also found pulsed mode emission, the kind you get with 905 superpulsed, outperforms pure continuous mode for tendinopathy. The wavelength matters, the power matters, the delivery mode matters. Now let's pivot to neuropathic pain. The burning feet of diabetic neuropathy, post-herpetic neuralgia, post-surgical nerve pain. The diabetic peripheral neuropathy data is leading the way. Multiple randomized controlled trials have shown that photobiomodulation reduces neuropathic pain scores and improves vibration sensation in patients with diabetic peripheral neuropathy. The wavelength that keeps showing up in the positive trials is 890 nanometers in the near infrared, sitting right between our 808 photochemical band and the 905 deep penetrating band. The proposed mechanism is twofold: direct mitochondrial support in the small nerve fibers and improved microvascular perfusion through local nitric oxide release. For people stuck on gabapentin, on duloxetine, who don't want to escalate the medication ladder, near-infrared PBM at therapeutic dose is a legitimate adjunct. And the reason it requires real power and the right wavelength: peripheral nerves sit deeper than most people realize. The tibial nerve at the ankle, the median at the wrist, the lumbar roots near the spine. The shorter wavelengths and low irradiance LED panels physically cannot dose those targets. Near-infrared at depth can. Practically, a typical cold laser treatment runs 6 to 10 minutes per region. The handpiece moves continuously over the target. Most people feel a comfortable warmth from the 970 nanometer thermal wavelength and nothing painful. A typical course is 6 to 12 sessions, 2 to 3 times per week initially, then tapered. Acute injuries are often treated more frequently up front. Chronic conditions may need tune-up sessions every few weeks once the initial course is done. Safety. Photobiomodulation has an excellent safety profile across thousands of published trial participants at therapeutic doses. Standard cautions: never aim the laser at the eye. Both patient and operator wear protective glasses. Avoid treating directly over active malignancy in the field. Avoid treating over a pregnant abdomen because the data is limited, not because there's a known harm. Dose is adjusted over tattoos because the ink absorbs more energy. Photosensitizing medications can change skin response. Beyond those, this is one of the better tolerated tools in pain medicine. Quick recap. Cold laser is wavelengths, 660 nanometers, superficial, skin and surface tissue. 800 nanometers, the deep tissue photochemical workhorse, where most positive pain trials live. 905 superpulsed, deepest penetration for joints and nerves, dose sensitive. 970 thermal, warms tissue and increases blood flow. The evidence by condition tracks the wavelength used. Chronic neck pain, 780 to 830 nanometers, Chow's Lancet meta-analysis. Knee OA, 785 to 860 or 904 when dosed per WALT and combined with exercise. Rotator cuff tendinopathy, 800 nanometer range, delivered at high enough power to reach the deep tendon. Diabetic peripheral neuropathy, near infrared around 890. Match the wavelength to the target. Deliver enough irradiance to get the photons there, and the biology does the work. If you want to learn more about whether cold laser might help your specific situation, visit our website at www.c4rpm.com. If you found value in today's episode, subscribe, leave a review, and share this podcast with a friend. Your support helps us continue to provide free content to support you on your journey to optimum health. This is Dr. Lewis reminding you that your body has an incredible ability to heal, thrive, and repair. Sometimes it just needs the right tools to unlock its full potential. We'll see you next time.